Hello everyone, I am Tia Rathi, counseling psychologist at TalktoAngel. Welcome back to our channel series on clinical disorders, episode number 14, Generalized Anxiety Disorder. Today we have Dr. R.K. Suri with us to talk about Generalized Anxiety Disorder. Welcome, sir.
Thank you, Ria.
So, first question is, what is Generalized Anxiety Disorder and are there any different types of it?
As far as general anxiety disorder is concerned, general anxiety disorder is a mental health condition which is characterized by excessive worry and concern about something which is not there apparently, and the person is overwhelmed on account of that worry which is impacting his or her functioning. As for the types of generalized anxiety disorders are concerned, they can be categorized as panic disorder, specific phobias, or obsessive compulsive disorder, social anxiety disorder, post-traumatic stress disorder, and adjustment disorder.
So my next question to you, sir, is why does generalized anxiety disorder happen? Is it linked to family history or lifestyle?
Yeah, thank you very much. As far as the occurrence of generalized anxiety disorder is concerned, it is often mentions and it is often reported that heredity is one of the factors, but there are a number of factors like lack of sleep, excessive overthinking, excessive workload, and lifestyle challenges. So we cannot say exactly that it is on account of family or is on account of the situations which are in the current environment of an individual. For example, the loss of someone near to you, someone dear to you, which could be a grief or it could be a trauma. Now, all grief and trauma do not lead to a generalized anxiety disorder, but they precipitate in the form of some or the other way of anxiety.
My next question to you, sir, is how can someone differentiate if they have generalized anxiety disorder instead of just normal stress? Or what are the symptoms of generalized anxiety disorder?
Okay, thank you very much. As far as the generalized anxiety disorder and differentiation between stress is concerned, stress is a event-based activity, and events could be a small event or a great event or a big event, and the response to the same may vary from individual to individual. Whereas in the case of anxiety, the transitory nature is not there. It is an excessive overthinking and excessive worry which is persistent in nature, which is there for a longer duration. That's the major cardinal difference between stress and the generalized anxiety disorder.
Rightfully said, sir. So my next question to you, sir, is how do professionals diagnose GAD? What should someone expect during the process?
As far as the diagnosis of GAD is concerned, the cardinal feature is the excessive worry, which is persistent for a duration, which could be 15 days to 1 month. Now, this could be categorized in the form of a lack of sleep, lack of appetite, or restlessness, agitation, etc. And in some cases, the person is not able to have a good appetite too. Now, it is different from depression, because in the depression case of depression, there is a low libido and there is lack of motivation, lack of interest. Whereas in generalized anxiety, it is more pertinent to your worry, which is not there in general sense, which is not being seen by most of the people, but the person who is facing it, he consider it to be a very much painful, and he gets overwhelmed. Now there are diagnostic criteria. DSM-4 and DSM-5 talks about that the person should be having an excessive worry. That worry, on account of that worry, he or she is not able to have a proper adequate sleep, or he or she is having an agitation and restlessness, and he or she is also having other physiological symptoms, what we call the psychosomatic symptoms. to diagnose the generalized anxiety disorder, there are tests which are available like Hamilton Anxiety Test, Beck Anxiety Test, and GAD questionnaire, Generalized Anxiety and Depression and questionnaire, which are being used by number of clinical psychologists and psychiatrists. I do refer that if you or any one of your friends or a relative is having anxiety challenges or generalized anxiety, you must go and visit our website at TalktoAngel and take free self-assessment to understand your level. But these are only suggestive and indicative. It is strongly recommended to seek a consultation with good clinical psychologist and psychologist at our platform TalktoAngel.
Thank you, sir, for the answer. So my last question to you is, how is GAD treated and what can someone do to feel better?
Thank you very much. As for the generalized anxiety disorder treatment is concerned, there are two approaches, what we call as medication approach, in which we try to provide medicines in the form of anxiolytic, which are predominantly SSRI, or in common parlance it is being referred as sleeping pills. At some time there is a comorbidity, then in that case antidepressants are being prescribed by a psychiatrist. It is strongly recommended that if any one of you or your family member is having an anxiety disorder, get it evaluated, get it diagnosed, and if you are not able to maintain your physical balances, physical symptoms covered, then you must get a medication by a prescribed medical attendant or a psychiatrist. And the other approach is what we call as the positive psychology intervention approach, where we provide cognitive behavior therapy, we provide mindfulness practices, we provide yoga, and also the relaxation techniques, and also the focused problem solution approach to solve the problem. The excessive overthinking is concerned, there is a need to change the thought pattern of an individual. For that, the CBT or DBT is widely used and is strongly recommended. At TalktoAngel, we have many psychologists who practices these modalities of therapies. I strongly recommend must reach out to TalktoAngel to get the treatment and change the lifestyle.
Thank you so much, sir, for the clear and informative content. Your insights have made this generalized anxiety disorder topic very easy to understand.
Thank you.
I would request you to like and subscribe to our channel TalktoAngel, and see you in the next episode.